Hello friends, today we are going to talk about one of the very common symptom gastroesophageal reflux and its treatment. In this video we will cover introduction, symptoms, causes, diagnosis, prevention, treatment. So let's get started. What is GERD gastroesophageal reflux disease? Persistent acid reflux. Acid reflux happens when content from your stomach move back up into your esophagus. This action is also called acid regurgitation or gastroesophageal reflux. And having this once in a while is common, but if you are experiencing this more than twice a week / very often, then you might have GERD. Symptoms of GERD. GERD symptoms. The main symptom of GERD is acid reflux. Acid reflux can cause an uncomfortable burning feeling in your chest, which can move up into your neck and throat. This feeling is often known as heartburn. So if you have acid reflux, you might develop a sour or bitter taste at the back of your mouth. It might also cause the regurgitation of food or liquid from your stomach into your mouth. Some other symptoms of GERD are nausea, chest pain, pain when swallowing, difficulty swallowing, chronic cough, a hoarse voice, bad breath. Causes. Occasional acid reflux is quite common, often occurring as a result of eating a large meal, lying down after eating, or eating particular foods. However, recurrent acid reflux, or GERD, typically has other causes and risk factors and can have more serious complications. GERD occurs in people of all ages and sometimes for unknown reasons. It happens when the valve that prevents stomach contents from going back up to the esophagus becomes weak or opens when it should not. GERD occurs more commonly in people with obesity or people who are overweight because of increased pressure on the abdomen. Who are pregnant, affecting around 40 to 85% of people during pregnancy. Who are taking certain medications, including some asthma medications, calcium channel blockers, antihistamines, sedatives, and antidepressants. Who smoke and those with exposure to secondhand smoke. In addition, hiatal hernia is a condition in which an opening in the diaphragm lets the top of the stomach move up into the chest. This lowers the pressure in the esophageal sphincter and increases the risk of GERD. Diagnosis. Anyone experiencing frequent acid reflux symptoms should talk with their doctor, who may refer them to a specialist in gut medicine known as a gastroenterologist for further investigation. There are several tests to diagnose GERD, including esophageal pH and impedance monitoring. This measures the amount of acid in the esophagus while the body is in different states, such as while eating or sleeping. Upper G endoscope. This is a tube with a camera attached that is used to inspect the esophagus. A small sample of tissue may also be taken at the same time for a biopsy. Upper GI series. This is a type of X-ray that shows certain physical abnormalities that might cause GERD. Esophageal manometry. This measures muscle contractions in the esophagus during swallowing. It can measure the strength of the sphincter. Bravo wireless esophageal pH monitoring. In this test, a small temporary capsule is attached to the esophagus. This measures the acidity continuously for approximately 48 hours. Aside from the lifestyle changes mentioned above, adopting the following changes may help prevent the onset of GERD. Eat small meals frequently. Avoid eating very large meals. Stay upright after eating. Finish eating 2 to 3 hours before going to bed. Quit or avoid smoking. Avoid strenuous activities after eating. Lose weight if overweight. Minimize wearing tight clothing around the abdomen. Sleep at a slight angle with the head slightly elevated. GERD treatment. To manage and reduce the symptoms of GERD, your doctor might advise you to make certain lifestyle changes, like maintaining a moderate weight, Quitting smoking. Avoiding big, heavy meals in the evening. Waiting a few hours after eating to lie down. Keeping the head elevated during the sleep and not lying down immediately after meal. Medicines to treat acid reflux. 1. Antacids. Antacids have been used for centuries in the treatment of patients with dyspepsia and acid reflux disease. It is typically used for occasional and mild symptoms of acid reflux and GERD. The principal function of antacid is to reduce gastric acidity. A single dose of antacid taken 1 hour after a meal can effectively neutralize gastric acid for up to 2 hours. 2. H2 receptor blockers. H2 blockers like cimetidine, ranitidine, famotidine and nizatidine suppress acid secretion. If you are experiencing heartburn or dyspepsia fewer than 3 times per week, then you can take antacids or H2 blockers. H2 blockers are best for nighttime acid secretion. And they are extremely safe medicines. 3. Proton pump inhibitors, PPIs. PPIs like omeprazole, pantoprazole, esomeprazole, rabeprazole also lower the amount of acid your stomach makes. The best time to take PPIs is approximately 1 hour before meal. Normal recommended dose is once daily. It relieves GERD-related symptoms in 85 to 90% of the patients. In some people twice daily dose might be needed. 4. Prokinetic agents. Prokinetics help to strengthen the lower esophageal sphincter and prevent acid reflux. The most widely studied agents include bethanechol, metoclopramide, domperidone and cisapride. It is used as a single agent or in combination therapy. 5. Foam barriers. Foam barriers are tablets that are composed of an antacid and a foaming agent. As soon as the tablet reaches to the stomach, it disintegrates and turns into foam that floats on top of the liquid contents of the stomach. It is a kind of physical barrier which prevents the reflux of liquid. The tablets are best taken after meals. Surgery for GERD. Doctor might recommend surgeries like fundoplication, during which the top of your stomach is sewn around your esophagus, and bariatric surgery, usually recommended when a doctor has concluded that your GERD may be exacerbated by too much excess weight. Homeopathy is very effective in managing all the symptoms of acid reflux and furthermore plays a very important role in preventing relapse of the condition. Homeopathic medicines will help decrease acidic buildup, restore the digestive system, and strengthen the lower esophageal sphincter. Remedy options. Carbo vegetabilis. This remedy relieves bloating and gas in the stomach, with belching. Lycopodium. Natrum carbonicum. Nux vomica. Pulsatilla. Antimonium crudum. Arsenicum album. Bryonia. Thanks for watching. Doctor Online 24/7. By Dr. Sana Bawani.